Hello.
Welcome, Noah. How are
Oh,
you?
I'm well. How about yourself?
I'm doing great. I really wish you were here in the Capitol in person tonight.
Me
The
too.
State of the Union is always really, it's a festive occasion and it's a meaningful historic moment, and
Yeah.
so, but what we typically do is we have one guest who
Mhm.
comes in person, but obviously with COVID, we couldn't do it in person.
Yeah.
So we've invited you to be my guest for the evening. And I just wanted to honor you and your service during COVID as a frontline worker and just the challenges that our healthcare workers have faced. So I'd love to hear more about it. What's your job?
Yeah.
How does it work? And what's it been like for you the past couple of
Yeah.
years?
Well, first, I want to say thank you so much for this opportunity. I'm really excited to do this. But it's been, challenging. I started out as a new grad nurse in June of 2020, right after I graduated
Wow.
college. So yeah, I graduated from Colby Sawyer College in May of 2020. So I jumped right into COVID. I don't know what it is to take care of a patient as a nurse without wearing a mask.
Wow.
And so that for me, I don't know anything different, so it's hard to compare. I was an LNA or a CNA, a licensed nursing assistant throughout college. So I had that aspect, but it's definitely different being a nurse. So I kind of jumped right into it. And the statement that I had talked about, I think really represents it. The experiences that I've had within these 2 years and the skills that I've learned are definitely things that I never anticipated happening over 2 years. I thought this was going to be 10, 20 years of the things that we've done. And so it's definitely been a great learning opportunity. When I first started out, it was about 3 months since after kind of everything shut down. I think it was like March of like 2020 when
Yes.
really things kind of shut down. So we were right in the thick of it. And it was very different. At first, we just like most of the hospitals had experienced that PPE shortage and that kind of
Yes.
unknown about COVID and what to expect. Almost 2 years now later, we kind of have it down to a T and we have everything, all of our systems in place. But it was
Yeah,
definitely
you're
challenging.
at Cheshire Medical Center.
Yes.
So I remember being on the phone with the CEO of Cheshire Medical Center
Yeah.
in March of 2020, frantically looking for PPE,
Mhm.
gowns, masks, cleaning supplies, trying to get in touch with Dartmouth. Did they have some they
Mhm.
could share? Could I call the suppliers? Could I get it?
Yeah.
So by the time you got there, probably they had that a little bit squared away.
Yeah.
I was even surprised myself, how this sort of just-in-time delivery of supplies, they only had like a few days supplies in many cases,
Yeah.
not even weeks. And
Yeah.
COVID was this massive worldwide disruption.
Mhm.
So we had a company up in northern New Hampshire making gloves, and they went
Mhm.
into, double, triple overtime to make the gloves. And so how many patients do you think had COVID when you first started? That first summer was, it
So that
started to drop off a little bit, but
Yeah, so that first summer, like I said, I started in the ICU at Cheshire in June. So I'd probably say June to August, end of September. We were averaging 3 to 4, 3 to 5 COVID cases at a time, and that was before the vaccine came out, and so we
right.
were, and that was still that first year of everybody trying to figure out how we combat this virus. So it was challenging. So we probably had 3 to 5 patients that first summer, and then
And
we
were
kind of
you working with COVID patients right from the get-go?
right from the get-go. So I was
Wow.
the last cohort for the new grads to do about 6 months of orientation. Being in a critical care disciplines, the orientation is typically longer just because of the skills we have to develop.
Right.
So right from the get-go, we were with COVID patients.
Wow.
So yeah, it was right from the start, and it was definitely, it's a learning curve, but it was all that I knew.
Right.
Everything kind of put on the back burner. So all the other diseases and everything that we
Yeah.
were seeing,
You were
it just
just zoomed
shifted to
right
COVID.
in.
And so it
And
was.
were you getting advice from the physicians and the other nurses? They
Mhm.
were, I mean, part of it was the whole story was evolving. We didn't
Yeah.
even know exactly, like, I have a niece who has long haul COVID,
Mhm.
and they didn't even understand that back then. That
Yeah.
summer, doctors were telling her, like, we have no idea what you have, what
Exactly.
you're talking about. Yeah.
And so that was definitely difficult, especially being more of like a rural hospital. It was it was challenging at first, but we have our medical director, Dr. Westlake, who's our head ICU intensivist. He's also a physician up at Dartmouth Hitchcock. So we, in our correlation with Dartmouth, we really adapt their perspective a lot of
Nice.
things. And
Good.
so everything that they do, we do, and vice versa. They've taken us kind of Cheshire under our wing, but we have a very strong infectious disease group and our infectious disease provider, Dr. Coley, and he is brilliant. And we have followed the guidelines ever since. But
Excellent.
as even the CDC and everyone, we were still learning. COVID was still
Yeah.
relatively new. We didn't have the vaccine. And so we were following the guidelines appropriate, following Dartmouth's interventions and suggestions.
When you had high numbers, and even this
Mhm.
past fall,
Yeah,
of people who refused the vaccine. And that must have been so frustrating for healthcare workers.
very, very frustrating. And it was, as throughout the country and all the numbers had mentioned, it was the people that were suffering the worst and having the most adverse outcomes, and the death we were seeing was the majority that were unvaccinated.
Wow.
And it's tough too, because not only does it affect the patient but the patient's family as well, and it kind of cascades from there. So after the vaccine came out, we had it. I, personally got it right away. Cheshire was really great about getting it out and then getting out to the community. Luckily, we have a great community here in Keene and the Cheshire County area. But then again, when patients came in, it was with unvaccinated when they had the opportunities. And I think a lot of it was education.
Yes.
They felt they
Yeah.
weren't educated enough on the vaccine. And so I think that was an issue, but it was challenging in 2021, especially the first part when we were all very excited. We had this vaccine. We really hoped that this was going to be on the mend. But then we saw our vast majority of COVID patients, the unvaccinated. And as you
Yeah.
mentioned, this last fall in the beginning of
Oh,
of
heartbreaking.
2022 was our worst. As you know, New Hampshire was hit very, very hard,
Very hard by
and it was our
Delta and
worst.
then by
Yep.
Omicron.
Yep.
I think we had some of the highest numbers ever
Yeah.
throughout the entire uh, course of the pandemic were
Mhm.
this fall. I think at one point we got up to 475 people in the hospital in
Yeah.
New Hampshire from COVID. And we had gotten down to, I think, 8 was the low mark the first summer and 13 was the low
Yeah.
mark the second summer. So that just seemed incredible to me,
Absolutely.
and
Yeah.
very
It was.
frustrating because we had the vaccine.
Yes. And at that point too, the boosters were getting more and more readily available.
Yes.
And this last time, as you mentioned, we had some of the highest. And I won't forget when we got one of the emails from our management team and infectious disease that New Hampshire, I believe, at one point for a short brief of time or a week or two, we were like the worst per capita
Number
with like
one
percent
in the
positivity.
country.
Yeah,
And
and
I
and
always
that
say
was,
we love to be number one for the
yeah.
presidential primary, but not for COVID.
Yeah, and that's what I think is really important about, New Hampshire's, a smaller state, especially Keene and Cheshire. We're not a big academic tertiary center, but we were just as affected as any other,
Yeah.
hospital. And I think that was really important. This past wave, it was largely again the unvaccinated. And that point, this past wave was super discouraging because the vaccine had been out for over a year. We've
Yeah.
had booster availability, and it got to the point where it was so bad, we were full in the ICU. We had to take more patients than what our policy is. We actually had to open up 4 more ICU beds down near the OR. So
Wow.
we're a 10-bed ICU unit here at Cheshire, and we had to convert 4 of the endoscopy OR suites into ICU rooms because to meet the needs of our patients. And we
Wow.
opened that up for about a month. But that second wave, everything kind of shut down again. Elective procedures, outpatient, meetings and everything, they were shut down. And so all that staff came back to support the ICU staff. But we would have, we would go from averaging roughly 8 patients on a real busy day with, these previous waves of COVID is probably 8 patients to 10 plus. And
Wow.
so if we didn't open up the 4 beds in the ICU down in the endoscopy suites, we wouldn't have been able to care for the community because we
Wow.
just simply
It's
didn't
so
have the physical
incredible.
space.
It's so incredible that you did meet the needs. And one of the things you said really hits home is that people lacked what they said, information and education about the vaccine. But
Mhm.
one of the things as policymakers we have to work with is that in fact they were getting information, but it was misinformation.
Yes.
It was information that wasn't correct,
Yes.
that wasn't scientific, that was politicized.
Mhm.
And that to me is in some ways the biggest heartbreak of the whole thing, is that people died needlessly.
Absolutely.
What I'd love to think about your career going forward. It's so amazing, and you probably don't even appreciate this yet at your young age. This will be with you for the rest of your medical career.
Yes.
That's what I find so amazing. And so maybe something like public policy and healthcare policy will one day come to interest you.
Yeah.
It's like, how do we educate the public?
Absolutely.
Sort of a public health challenge of, we have the science, we have the answer, we have the steps that we can take, and even honestly, more testing, I think we could have done. We could have maybe met people where they are. If you're not comfortable with the vaccine, can you get tested every week to keep your family safe? Maybe come up with some options rather than just trying to fit everybody into one.
Exactly. It's funny you mentioned being young and entering the field, and this is going to stay with me. When I graduated May of 2020, COVID is happening, but the new nursing students that are coming in, this is going to be forever. This is going to be what they're taught in school, just like as we were taught, all these previous viruses. They're going to be taught about COVID, and they're going to be educated on airborne and precautions and how we prone patients. That was something, the proning and the caring for these respiratory patients was something that you never learned in school. And the second I got out of school, it was, we need to know these skills. I think you bring up a great point about the misinformation. And it was devastating to see the patients pass and have not good outcomes because of that misinformation. I won't forget without saying any information, we had a husband and a wife who was on our general medical surgical unit. Both had COVID, and the wife was really not doing well. She was kind of in that range where her previous medical history and her comorbidities really put her at risk. But that patient didn't get the vaccine because they thought there was fetal cells in it and all these other components, strictly because of misinformation and what she read. And I won't forget the day that it was decided she needed to come to the ICU to be intubated, and we wheeled the ICU team because of her care and what she was requiring. We actually went to the floor and helped bring her to the unit. And as she's wheeling in, we had the room all set up. All of our doctors were there. Everyone was ready we were going to go right now. But I won't forget when she was saying goodbye to her husband and they were reaching out and touching, like holding hands, and said, "I'll see you soon." But she passed 2 days later. But it's just, things could have been prevented. And that was one of the hardest part for our staff, is having patients come in and not get the vaccine because of what their friends said, or because they thought that getting the vaccine would give them COVID, and all these ideals that just were not logical. And that was, I think, the hardest part, is the amount of patients who suffered and ended up dying because of that misinformation. I'm hoping now that after seeing the numbers, that people really start to get that, hey, it's been a year now. People who've gotten vaccinated, we're fine.
And they've done well.
Exactly.
And
And it's hard to not look at the numbers as well, especially from a healthcare provider. When you're just looking at just the facts, the vaccinated, and especially those with a booster, do better. And that
Yes,
is, and it's
yes.
just, and that's in every hospital. So, but it was definitely tough. That misinformation you mentioned
It's
was
hard to
hard.
hear. I'm so grateful, Noah, for joining me and just hearing all about your job. And what I'm mainly grateful for is your commitment to healthcare and to the community and to keeping people safe and healthy. And you're going to make a fantastic nurse. We're lucky to have you in New Hampshire. And if there's ever anything you need from me, I may reach out to you from time to time in terms of
Okay.
healthcare policy. And,
Yeah.
this will be the beginning of a good relationship. I really appreciate your help.
Well,
And
thank you so much
good
for this
luck.
time. I really, it was an
Absolutely.
honor having this discussion with you, and I hope you have a great rest of your night. And again, thank you so much for this opportunity.
Great. We're blessed to have you in New Hampshire. Thanks
Thank
so
you.
much. Take
Take
care and
care.
stay safe. Bye-bye.